Hello, everyone. It's Erin. I am here to do another live event. This actually came to me through a combination of different factors. What I'm going to do is try to multitask, and those of you who know me know that I'm not that great. But it's the new year. And so I have been reflecting on my past year and thinking about the goals that I want to set for my next year. And that actually has kind of set me up to think about that's really what we're doing when we're doing assessments. So I see that we have at least one of you is out there. I can see your chats. And so I would love for you to ask questions, put in your thoughts if you have similar experiences, whatever you would like to share with me. I would love for you to do that, and I will do my best to keep track of all of those that might be coming in. And um, so, as I was saying, I have been looking at the past year and thinking about the next year. And really, when we think about assessments, that's what we're doing, or that's what we should be doing. Because being a good detective is really being curious and asking questions and then putting together the pieces of the puzzle. I love murder mysteries, and they often delve into the background of the murder victim as an example to try and understand his life. And that's a long ways from doing assessments with babies, but that's what we should be doing as well. Being a good detective is about having curiosity and having an open mind and looking at all of the pieces of the puzzle. That's how we can identify patterns. And so we're going to use a case study. It's sort of a conglomeration of a couple of different kiddos. I have been doing some mentoring. In fact, we are going to be starting to offer some mentoring with me this year. That is a new offering that Feeding Fundamentals will be having. And in doing some mentoring with newer staff, what I often find myself asking them is questions about, well, what has happened to date? And I'm unfortunately surprised at how often people say, "Oh, well, I don't know exactly how old this baby is," or "She was preterm, but I don't exactly know how preterm this baby was," or I know that this baby had reflux, but I don't know when that was diagnosed or if it was diagnosed. And so we're going to take a situation, a somewhat fictional situation, and use that to kind of think through the importance of getting a really good history. And what are you looking for when you're looking in that history? And by the way, we have a history questionnaire on the website under downloadables as well, if you're interested. There are many different um, forms out there. I know the American Speech and Hearing Association also has forms to help with history taking. And so here is the situation. Here's the scenario that I'm going to give to you. A therapist comes to me and says, in today's mentoring session, I really want to talk about this new baby that just came onto my caseload. Okay, so this is how the case is presented. This is a baby who's about 5 months old now. I don't think she was premature, but she had reflux and it was really, really bad, and she wasn't eating. And the only way parents could get her to eat, um, you know, was by doing kind of extraordinary things. And they were working with a gastroenterologist. The GI physician finally put the baby on medicine. The parents were able to get this baby to eat, doing, kind of unusual things. So the baby would eat best in dream sleep. We all know that that actually is quite related to reflux. But the parents found that that actually didn't always work. And so the other strategies that they used was to sing to the baby, walk around the room with the baby, and bounce the baby quite vigorously. And the baby is now eating. The concern is not about eating per se. The baby's eating and growing. The baby is weaning off of GI medication. That's a strong goal of the family. And the family has seen a couple of different speech pathologists, I believe also one occupational therapist, to help with helping them feed their baby without these kind of extraordinary measures, and it hasn't worked. And so they have come into early intervention service now. They were seeing private therapists. They've come into early intervention services now, and that is where this therapist works. And so the therapist question to me is, so how do you get the baby to wean off of or to not need the bouncing and the singing and the walking, because the parents just want to be able to sit down and feed their baby. Okay, so that's the scenario. All right, probably you have had something similar in your past, because it's not that unusual for a baby with reflux. And so um, where would you start? All right, if this was kind of a scenario dumped into your lap, where would you start? The answers are oftentimes in the questions that we ask. And that includes my questions when I'm mentoring someone, but clearly, in this case, I was mentoring this person to ask questions of this family. And so, what would be some of the questions that you would have in your head? This is a 5-month-old. We know that somewhere between typically 2 and 4 months, a baby is going to be transitioning out of reflexive into voluntary eating. So my first question was, all right, when did the feeding problems start? Because usually the feeding problems are going to precede the gastroenterology visit, right? Why would you go to the GI if you don't have feeding problems? And so how how long has this been a problem? When did it begin to be a problem? How quickly did it become a problem? How quickly did the family seek services for the first time? The second question that I had is, all right, so I'm assuming that the extraordinary behaviors of bouncing and singing and walking were things the parents were doing prior to getting professional help. But do you know that that is the case? And the therapist said, well, actually, I don't. I don't know when those things started or when the parents started to do that. I asked, did they do all three at the same time, or did they start with one and then add a second one and then add a third one? Actually, that is quite common, especially with babies with reflux, right? Because a distraction is a distraction until it becomes part of the process. And so I may be distracted by your singing, but at some point, singing is part of the feeding experience, so it's not a distraction anymore. And so parents add a second and then a third. So my question was, well, how did that work? And the therapist wasn't sure what the answer to that question is. And I'm this is quite common, I guess is what I'm saying. It has prompted me, because I have seen it in so many mentoring sessions, it's prompted me to do this Facebook Live. So that was my next series of questions. My next question was, and when did they see gastroenterology, right? And what would you be asking about that gastroenterology visit? Any ideas? I am wondering if the gastroenterologist suggested any changes in food. That actually is also a question you would want to ask from the beginning. Did the baby tolerate one kind of food, like human milk, and began showing reflux symptoms when the baby was placed on formula, and what kind of formula? right? So those would be questions that I would want from the gastroenterologist. What did the gastroenterologist think? Did the GI physician diagnose reflux, or is that a report that the parents have? In this case, we knew that the GI physician had diagnosed that because one of the outcomes was he started medication, GI medications. All right, so we have a time point of when medications came on board. Feedings got better. Parents were continuing to do the singing and rocking and walking and bouncing. Feedings stabilized, we're doing pretty well, and the parents' goal right now is to wean the baby off of all GI medications and be able to feed their baby just sitting down. So that's now going to prompt the next question, which is, all right, when did you start the wean? Have you started the GI physician's recommendation to wean? How long have you been weaning? How much have you weaned? How close are you to weaning completely off? Because if you have a baby who is succeeding in feeding because of medication plus distractions, now we have to start to figure out what should we wean first, and how are we going to know if we're not being successful, right? If you wean off medications and you try to get the baby to eat without distractions and the baby stops eating, is it because the baby still needs medications? Is it because the baby needs the distractions? And so where the therapist was coming in was actually, how do I get this baby to eat without distractions? And where I brought the therapist back to is, you need to understand why the distractions were started, and you need to have a really good understanding of how are you going to slowly wean those down and not lose skill. And I would not recommend doing that at the same time of medication wean. So it's really about kind of laying things out on a timeline, right? Maybe the GI medications, if that's number one goal for the family, the key then is to sit down and say, your baby may be eating well because they are getting medication, or because you're using distractions, or both. And so if your goal right now is to wean off medications, let's do that and not try to change the feeding experience just yet. Now, obviously that's time dependent, right? Because if the wean is, we'll just let the baby get bigger and not weight adjust, it may be months and months and months. In which case, you would potentially say, while we're doing this very slow wean, we can initiate a very slow wean of the behaviors that might be supporting your baby eating. Because if you take everything away and the baby stops eating, sometimes they won't restart feeding, right? Because now they're involuntary eating and they learn very quickly, especially when it's associated with pain. And so my request of the therapist was, I want you to write down the questions that you're going to ask so that you can have a very clear timeline as to, when did the problem start? What was done at what time? How successful were the GI medications? Were the distractions? What is the parent's goal? Are they going to prioritize getting the baby off of GI medications? Or are they potentially more comfortable with saying, oh, let's keep the GI medications, let's wean the behaviors first so that I can feed my baby sitting down and enjoying that experience. And once we know that the baby can be successful without the distractions, then restart the wean. So it really, the end reveals itself by looking at the beginning, by reflecting back on what does this whole thing look like. Now, the other thing about reflecting is you can also look for patterns. And it's actually a big reason why we ask questions and why we need to have that open-mindedness and curiosity. The questions oftentimes are, you could break down into some fairly simple ones. Was the baby ever eating easily, comfortably, and well? So maybe the baby was doing beautifully for the first 2 months. If the baby starts to struggle around that 2 month age, obviously one of the things that is changing is they are learning that they have a choice. However, the other thing that you need to verify or look for is, did anything else change? Maybe the food changed. And I gave you one of those examples. A lot of families are providing human milk, and when the lactating parent returns to work, they may not feel comfortable with um, pumping. They may not have, a good milk supply to begin with, and now without a nursing baby all day long, sometimes they're struggling with milk supply, and so they may start formula. So we need to think about that. Look for inflections. Look for changes in the growth curve. Look for changes in those feeding behaviors. Okay, if it was working and it isn't now, when did it change? And what else was changing at that same time? So those are some things to be thinking about. Um, I love to do mentoring. I love kind of that critical thinking with people and teaching them to really not jump to how do I fix it, but start with what has the story been? How did we get here? What are the different pieces of the puzzle that I need to think about? And I will tell you, sometimes that is even more challenging when we have a pretty obvious answer sitting in front of us, right? Very easy if you don't go in with an open mind and being really curious about the whole story. Very easy to assume that everything is because of reflux. And what if the baby has reflux and an oral feeding problem that maybe didn't show up until they were taking larger volumes, which happens when they get older. And so these are some of the things to think about when you're thinking about defining goals. Looking back and reflecting can also help you set up realistic goals. Has the baby been making progress? How much progress have they been making? This is one of the big sections that we talk about in the SOFI training, is looking for the rate of progress, not just is the baby making progress, but the rate of progress, because that will help you to predict what the short-term goals might be, what the long-term goals might be, how long the child might need that support for you. The other piece of that is if you understand the trajectory of the baby, you can then look for an inflection point that happens because of your therapy. So if the baby has been making progress like this and you change something, and they all of a sudden start making progress like this, that inflection can be hopefully tied to the interventions that you just implemented. So these are some important things to think about. So I gave you an example of an older baby. I will tell you this is exactly what I do when I'm doing assessments in the neonatal intensive care unit. When I go in to see a baby for the very first time, I do not start with what the baby is doing. I spend time reading through the summaries of what has happened with this baby. How long were they on oxygen, if at all? Were they on mechanical ventilatory support of any kind, and how long? What have they been getting enterally into their tummy? Are they on human milk? Are they on human milk with fortifier? Are they on any kind of formula? I'm looking for patterns. So I start writing out all of the things that are in that electronic medical record. One of the things that I'm fond of saying is EMRs are like black holes. People put in, they document, but no one ever reads all that wonderful documentation. You want to know what the 14 bedside nurses who have fed this baby, what their experience was, so that you can add it to what you see when you work with the family and do your assessment. And so I'm constantly looking at what are the volumes that the baby was taking orally? What was the bottle system that the baby was taking, if at all? What was the, um, the GI inputs, those kinds of things. So thinking about using all of that rich data, ask lots of questions, be curious and open-minded. Observe then what the baby is doing with you and be really attentive to details. The devil is in the details is something that my friend Kate Toomey says all the time. So really thinking about what are the suck, swallow, breathe steps that you're seeing. In Sophie, again, we talk about skill, efficiency, endurance, consistency, volume, right? And so skill, what are you seeing in terms of their suck, swallow, breathe coordination? Efficiency, what are you seeing in terms of their engagement of good suction and volume per minute? What are you seeing in terms of endurance? Are they still awake at the end of the feeding? Even if they haven't finished the feeding, they're awake, but they're no longer eating, or they don't want to eat. Okay, so thinking about that attention to detail and really being a good observer of the baby's communication, of the parent-infant interaction, and of the skill, efficiency, endurance pieces of the infant. That is going to then inform your decision making. That evidence base that we talk about is not just evidence that you get from research articles. The evidence is also what the infant and the family are giving you and what the history gives you, what that electronic medical record gives you. Once you have all of those pieces, it really is putting things in to the puzzle and looking, does this piece fit? And if it doesn't fit, is it a matter of you're sort of right, you just need to rotate the puzzle piece? Or is it, if that doesn't fit, I'm missing a piece, and asking more questions. So this has been a live uh, little fun event that my team has asked me to do. They're constantly asking me to be a little more available and interactive because that's what we hear from you. The evaluations that we get from Sophie trainings and all of our other wonderful trainings that are on our website continue to reinforce that we want to have that connectedness, even if it's during things like this. And so we will be trying to schedule these more frequently. I will keep trying to pick things from the mentoring to bring into these kinds of chats, if you will. The best way for me to know what you want me to be focusing on is going to be leave comments for us. Many of you are not going to be on this as a live event, but you may be able to see it as in our feed, and we're still going to be looking at your comments. Share it with people as well. We would love for you to share this little pieces as well. The last thing that I want to point out in terms of being a good detective is patience. I would tell you that most of the time I don't get it right the first time. So I need to have a clear understanding of what I'm trying to change, what trajectory am I focused on. I need to have clear outcome measures to help me to see, am I changing it? And then I need to be humble and to go back and to try something new. And once again, trying something new comes from what's already been tried and what were the results of what has been tried, so that you're not redoing things that have already been tried and didn't work. Or perhaps the circumstances have changed and it didn't work then, but maybe it will now. I'm going to wrap this up by just telling you the answer to the therapist question: how do I wean this baby off of these extraordinary behaviors that her parents are doing? So what I pointed out is anytime we're weaning, you want to do it slowly. And you want to do it in a manner that the baby can stay successful. It comes back again to something we talk about in Sophie, the just right challenge, the tolerable stress. So my suggestion was, if the parent is walking and singing and bouncing, maybe talk to the family about, okay, which one do we want to tackle first? Don't try to do all of them. Okay, I want to stop singing. All right, so maybe what you do is you sing and get the baby started, and then you pause for 30 seconds and you sing, and then you pause for 30 seconds. If the baby doesn't eat very well when you're pausing for 30 seconds, pause for 15 seconds. If you've tried that and it isn't working, maybe that's not where you start. Maybe instead, as you're walking, you stop walking for 10 seconds and then you continue walking. And you're watching for, when I stop walking, does the baby stop sucking? And maybe the baby continues to suck for 5 seconds and then pauses. And after 10 seconds, you start walking again, and the baby then starts sucking again. What you're doing is you're trying to help them be successful and then maintain that success even during pauses in the stimulation, and then restart. And so we talked about, personally, I think I would stop bouncing first because to me, bouncing a baby when you're feeding them is highly disruptive, maybe also destructive. But that's my choice. It's not really my choice to make. And so I would be asking the family, maybe stop bouncing. If the baby has reached the point where they don't need bouncing anymore, then tackle the next thing. And so that's the answer to how do you stop it. But you have to understand, why did it start, so that you can look for, when you try to wean, that you don't lose that outcome. So on that note, I am now going to go ahead and shut this down. I might actually do a little, I don't know, I've already actually put in a quick little blog on our website, www.feedingfundamentals.com. But I will also be thinking about perhaps doing a little mini video on something like this, taking parts of what we did here on Facebook Live. Please send us information that you would like um, more talking on, if you will. Put things in the comments. We would love for you to do that. Like our pages and, help us to reach more people. So enjoy your new year. Enjoy reflecting back on 2024 and making goals for 2025. And I will see you again soon. Bye.